There is new hope for lung cancer patients. Here with exciting news on breakthroughs is oncologist Dr. Julia Bramer and Barbara Marder. She is a 74-year-old lung cancer patient. Good morning to you both.
Good morning.
So we are talking lung cancer, but there are some exciting breakthroughs with lung cancer treatment options. And we know this type of cancer is the most deadly form of cancer. So talk about the new hope.
Certainly there are things to hope for. We have definitely new treatments that are being developed every day. One particular treatment is targeted to a patient's cancer's mutations or changes. So it's very important for lung cancer patients to ask about genetic testing for their cancer. Based on these tests, there are some mutations where drugs have been developed to hit those mutations. They cause cancer shrinkage and control for a very long time. Unfortunately, for some of our patients, they don't have any of these mutations. And we're also developing different types of treatments, such as immunotherapy. Immunotherapy is being developed to use your own immune system to be able to battle your cancer.
Yeah, and I mean, there is relief, and good to know that there are options out there, light at the end of the tunnel. But Barbara, what has it been like for you as a lung cancer patient? What has life been like?
It was pretty upsetting when it was first discovered, and that was a little over 4 years ago. At that time, I rather rapidly had surgery that removed one lobe of my lung and thought that the cancer situation was under control, that it was gone. Not totally so, because about 18 months later, it had metastasized to the other lung, and again I had a couple of tumors that needed some kind of treatment. It was at that point that I talked with Dr. Bramer. I really wasn't a good candidate for additional chemotherapy because I was a kidney donor many years ago, and the drugs are really a little hard on the kidney. However, I was able to find out about immunotherapy and elected to become a part of a clinical trial using an immunotherapy drug. For me, this has been tremendously successful. Within 6 weeks, my tumors started to shrink. Within 6 months, they were no longer visible on my CAT scans. It's been over 2 years ago. I continue to have an infusion of the drug every 2 weeks, a CAT scan to check things out every 12 weeks. I continue to show no signs of cancer. It's a miracle for me.
Yeah, I just got chills listening to you. That's great news. Dr. Marder, are there treatments or a cure? Can you say that there's actually a cure for
Well, certainly
lung cancer?
not yet. We can't yet say the C word. We hope in Mrs. Marder's case at some point we can. But in order to get to that, we need to focus on research and really developing these types of therapies and figuring out who best to use them on and really who best will benefit from them as well, and how to develop new treatments. Research, of course, needs funding. Unfortunately, lung cancer is one of the least funded cancers by our federal government, and so groups such as the Lung Cancer Foundation of America are working hard to help contribute to that funding and using donations to fund research and, again, give our patients hope. In fact, as a patient or family member, as well as your listeners, you can go to the Lung Cancer Foundation America website, lcfamerica.org, learn a little bit about lung cancer, take a survey. You can actually enter into a contest to win a Fitbit, but most importantly, be part of their 30 Days, 30 Ways campaign. In this campaign over the next month, you can pick a day and increase awareness about lung cancer, and in doing that, encourage friends and family, as well as, in my case, other patients, to help donate funds to this website, and which will go directly towards research. This is very important to give our patients and their families new hope.
Thank you both so much, and that website again sounds like a great resource as well. Barbara, as we close, what advice would you give to anyone maybe in your position or anyone with lung cancer? What would you say to them?
I would say to anyone that was diagnosed with lung cancer or any other serious disease, get more than one opinion. Do your research. See what organizations like the Lung Cancer Foundation are available to provide information and help. Go to this website, lcfamerica.org. Lots to learn.
All right, thank you so much. And for more on what these ladies talked about, head online, check out our website, fox4morningblend.com. Quality, selection, and customer service. Those are just some of the key ingredients from one local grocery store. Coming up next, we mix things up and hit the bakery at Oaks Farms to see what kind of treats we can take from seed to our table.